The teacher to get a video of that.
Alright. This week I'm having to choose one topic in which I'm interested in educating my facility about on national patient safety goals. Since we all know patient safety is a major aspect in relation to patient outcomes, I chose to do fall prevention. My goals for this presentation is to ultimately be able for us to decrease the patient fall occurrences here in the MSICU by 50% within the next 6 months. I know this seems like a long shot, but with our teamwork and determination, I believe we can accomplish this goal. Also want to reiterate the importance of patient safety. As we all know, the patient safety is a major aspect when patient outcomes and satisfaction. By preventing falls, not only are we maintaining a safe environment, but we're able to reduce hospital costs. Finally, my last goal is to reinforce our current practices and introduce new interventions to improve patient safety. During my research, I found that improvements in patient outcomes by preventing falls was a huge success. We never really slowed down enough to think about it, but falls are the most common preventable adverse effect in hospitalized patients. By decreasing our patient fall occurrences, we are preventing long-term consequences and other life-threatening conditions to occur in relation to an injury from falling. For this presentation, I found 3 articles that I thought would show us some advancements we could bring to our unit as well. The first article discusses how through the use of planning and interventional techniques, we can reduce patient falls. It stresses the importance of proper documentation of the Morris Fall Scale, which is easily accessible in McKesson. The fall scale helps us as nurses to determine the patients at high risk for falls and be able to intervene accordingly. The article also discusses the use of fall risk signs to be placed in patient rooms to alert the patients, their families, and as well as staff members on their risk for falls. I know as a nurse, oftentimes we find ourselves trying to help other patients when we are not sure of their ambulation status, placing the patient at risk for falls. The second article talks about the elimination and reduction of falls by increasing staff awareness to patients at risk for falls. The article recommended and showed the success of the use of daily staff huddles, visual alerts, and a board that recognized all the falls within the unit and was used there as a problem they were trying to fix. The facility, as mentioned, the board to show fall occurrences and listing ways in which it could be prevented. Throughout this process, the unit began seeing success rates and were treated with positive reinforcements for their no fall rates. My last article to discuss, in which I gained some insight, was allowing the patient themselves to be notified of their risk for falls by making them aware. By engaging the patient in their care, they become more involved and can be educated in order to reduce the occurrences of accidental falls. We as nurses can clear clutter in the room, make sure the room lighting is bright, provide non-skid stocks, and keep the call light within reach for the patient to call for us before getting out of the bed. I hope you all have enjoyed my presentation. I look forward to implementing these changes in the near future. Do you all have any questions? Okay, thank you. This is just a list of references that I use for my articles.